Hello everyone, how are you all? I hope you would be fine. This is Ms. Sidra Kashif representing MSK Linguistics Center from Pakistan, Karachi. Being a founder, moderator, plus EFL and IELTS instructor. It's my honor to have a very special guest from London, Lisa Hourihan, TEO Academy's director and co-founder. It's my pleasure to talk about really relevant topic as per her expertise OET to NHS, how to prepare for healthcare careers. Indeed, this topic is going to be really fruitful to all of you, especially if you are a medical student, healthcare professional, or thinking about medical field. Or if you are not, don't worry, there would be anyone in your family or around you who would be thinking the same, or it would be related to him or her. You may just recommend that live podcast to him or her. You may share it as much as you can, because we are going to discuss about OET, Occupational English Test. It is for healthcare professionals especially. And also we would like to discuss about NHS. NHS is National Healthcare Service in UK, which allows you to work in UK being a healthcare professional. So there are some requirements and eligibility criteria, and we would like to discuss about the challenges and its overcome. Being an expert in this field, Lisa would disclose these all things. Hello, Lisa. How are you? Warm
Hi,
welcome to
Sidra.
you.
Thank you so much. Thank you for the lovely introduction. I will correct you very quickly. I'm Manchester in England, not London, but we're not that far away. But
I'm
aside from
really
that,
sorry.
no, it's absolutely fine. It's really lovely to be here. I feel very grateful that you invited me. So thank you. Thank you so much.
Most welcome. It's my pleasure. So, really sorry for any inconveniences. Sometimes it happens.
Oh,
Okay.
family background. You can see my Christmas tree going in the background here. So
Oh,
I understand the
might be I
family
saw
dynamic.
something about London relevant to you. Then I thought that you belong to London.
We're not too far away. We're the northwest of England. It's about 3 hours on a train, so it's not far away at all. And I've been to London several times as well. I have
Oh,
students in London, so yeah, it's absolutely fine. Don't you worry. It's very close.
thank you so much. So now nice of you. Okay, dear Lisa, first of all, would you please introduce yourself to our audience so they could get to know about yourself, as the introduction which I have given, it's not quite sufficient. So you could elaborate about yourself very well.
Absolutely, absolutely. So my name's Lisa. I am still currently a registered nurse with the UK's NMC, which is the Nursing and Midwifery Council. That's the regulatory body of any nurses in the UK. I still work in part as a nurse. I still do medical assessments of people about their function, and I work still with a lot of other health professionals that are currently practicing in the NHS and private healthcare sectors in the UK. So I work with doctors, pharmacists, occupational therapists, physiotherapists, and everybody in the medical field, from healthcare assistants all the way to your consultant doctors, surgeons, anesthesiologists, as they say in America. So yeah, I get a sort of day-to-day contact with lots of different healthcare professionals. Um, my background
Interesting.
really, my forte really was intensive care. but I've worked in medical, surgical, lots of different departments. So my knowledge within the NHS and private sectors is very, very broad, very deep.
Okay, interesting. Dear Lisa, I am really amazed after getting to know about that being a nurse to have multiple of the years experience in that field. Then suddenly you converted yourself to teach English globally to healthcare professionals. Would you please discuss about that? As I am really curious about that to get to know.
Yeah, absolutely. So I always love speaking to people from all over the world. I love different languages and different cultures. It's always been a huge passion of mine. And when you work in healthcare in the UK, you meet people from every country you could think of. I've worked with nurses from the Philippines, doctors from Iran, psychologists from Poland, anywhere and everywhere that you can think of. I have worked and spoken with these people. And what I found in healthcare specifically is that where there's a sort of breakdown in communication or a breakdown in understanding what someone's trying to say actually can have a real detrimental effect because you're looking after some person's life and their health. And so communication in healthcare is so important for patient safety. And it's always been an interest of mine. From that, I then kind of learned how to teach English as a foreign language, and I did a teaching course to qualify in on the TEFL qualification. I also have a
Hmm.
mentorship qualification, which is like a degree module in mentoring as well. So I started thinking I can sort of amalgamate the two, my medical knowledge and my
Hmm.
interactions with medical professionals with accents from all over the world,
Hmm.
with actually helping to improve patient outcomes, improve patient safety, and just improve communication across all sort of aspects of healthcare. I then started to work teaching on some of the greater known platforms as a medical
Hmm.
English tutor, and I wasn't. I loved the students. I loved the teaching. I didn't love the costs and commissions and low rates of pay for tutors. Honestly, that was kind of my catalyst for launching TO Academy. So TO Academy is an online learning platform for languages, and
Yep.
we don't teach children, but we just teach adults, so professionals, business, healthcare being my forte. But we have tutors on there from lots of different industries now. Um, and it's a sort of much fairer for the tutors as well as the student experience. And with that specialist tutor comes specialist knowledge. And so that is why I launched TIO. So it came from nursing to teaching to building a platform and managing a global group of tutors. So yeah.
So, did you just leave that professional profession, or are you still in practice? If
Oh
I
no,
talk about nursing, especially.
yeah, still in practice, still nursing. I do that remotely now. So after the COVID pandemic, a lot of our assessments of patients became remote because you don't necessarily have to get someone into clinic to ask them about
Hmm.
their symptoms. Obviously, there are certain times that patients still need to be in clinics and in hospitals and in x rays and scanners. But a lot of what we can do now, we can do by asking questions. And so I still practice, but remotely. Yeah.
It's all about virtual assistance. You can say, as you know, that now the world became really advanced. We do have facilities we could do online. So now you do it virtually
Yeah.
rather,
Yeah.
rather than physically.
Yeah. So I kind of left. I had some health conditions of my own, um, which I won't get into today. I don't want to bore everybody with me. But because of my physical limitations, I couldn't physically continue to work on the wards. Um, but with my knowledge and my skill set, I can continue to assess patients and speak to patients and advise patients. And I love that. I love that. So I'm still involved, very much involved. Um, I'm just not physically clinical at the moment.
Okay, but the thing you are doing, it's remarkable. It's really appreciated, as you are just running that profession as well, along with that your TEO Academy, where number of educators are found on your platform. I have visited it. It's quite interesting. They teach there. It's like Preply, and you also teach there.
Yep, I still teach on there. I'm registered as a user, as a tutor. It's like Preply in its sort of format, although our commissions are only between 10 and 14% instead of 33. And we don't expect tutors to give away their time for free. So all lessons that tutors carry out, they get paid for fairly. So that's the big difference between us. But the platform format is very similar. Yeah.
Similar. Yeah, it is. So kind of you. I really like the way as you are dealing.
I felt like we needed an ethical platform. And at the moment, there wasn't anything out there. An ethical platform, but a platform that also had the best tutors, the best industry specific tutors.
It is. Okay, so dear Lisa, I have designed few questions as per our topic. If you allow me, shall I ask you?
Please, please go ahead.
Thank you. So first of all, it's all about OET um, and NHS difference, and why is OET crucial for healthcare professionals having desires to work in NHS?
Yeah. So the OET, as you said at the beginning of the podcast, called the Occupational English Test,
Yeah.
and it is designed specifically for healthcare professionals only. So that does include doctors, nurses, physiotherapists,
Hmm.
pharmacists, anybody wanting to work in the healthcare industry in the UK. The OET is the test that is the expected benchmark for being able to qualify to work in the UK in the National Health Service. It's crucial because it proves clinical communication competence. So IELTS, for example, you can be excellent at speaking English like yourself, really knowledgeable in terms of your grammar and your tone and all the other things that you learn as you learn to speak the language. But the
Hmm.
OET tests clinical healthcare um,
Hmm.
competencies specifically. So it's just real healthcare communication. It sort of ensures that health professionals coming to the UK can communicate verbally, they can document patient notes, discharge papers, clinical letters um, effectively, and work safely in a clinical hospital or healthcare setting in the UK. So it's very specific, very specific to healthcare professionals.
Yeah, it is because it's all about medical vocabulary, communication. It's all about clinical conversation or communication. If we talk about reading, listening, or writing, it's the same. To have a specific vocabulary, and it's quite challengeable as compared to real world English communication.
It is, and there are marked differences. So you can be an excellent English speaker, and have excellent written English, excellent listening skills, and excellent speaking skills. However, to move
Hmm.
from a general everyday language into a clinical, medical specific language, there is a huge difference. And the way in which we communicate internally in medicine is very unique. It's very there are words and phrases and ways of explaining things that you wouldn't use in everyday conversation. It just wouldn't happen. I imagine you go to your own doctors or nurses in your own country in your own language, they seem like they're speaking in an entirely different language again, because you know all the words, but clinically it makes no sense to a lot of people. So that's why the OET is super specific. It ensures that your medical language levels are appropriate.
Hello,
Can
hello.
you still hear me okay?
There is internet issue. Sorry,
That's fine. What
it's
I have
reconnecting.
Okay, good, good. I didn't want to continue speaking if it was
Yeah,
gonna not pick up. So yeah.
yeah. It's okay. Okay, let's move to another question. It's all about that how to prepare for OET effectively for boosting chances to join NHS to meet the eligibility criteria of NHS according to UK.
Yeah. So, I mean, in terms of preparation strategies, um, you kind of it's useful to understand the examination structure. Um, Spend time focusing on your weaker skills. Quite often, that is writing in another language. A lot of people are very good at hearing and understanding and
Hmm.
speaking a language, but clinical, medical, written language is quite often an area where people struggle. So, sort of focusing on that with a
Hmm.
good tutor, um, learning vocabulary that's specific to healthcare. Um, so, there are certain words in medicine that translate across the globe. So an ECG is an ECG, whether you're in London or Lisbon, it's still an ECG. But there are other words and terminologies and vocabulary that are very medically specific. Um, so it's useful to ensure your as a student as your vocabulary knowledge is good. Um, and to do that, keep lists, practice vocabulary and definitions. That's always a really useful strategy. And to practice the exam style tasks. So, again, with a tutor or alone, you can practice listening, you can practice the reading of policies in healthcare or guidelines that are, the most suitable pathways for cancer treatment. So, focusing your reading on very medical specific documents. Again, writing. So, writing everything in the NHS is written. One of our one of the most important things to remember is that if you didn't write it down, it didn't happen. So what that means is you need to have a a documented written
Hmm.
list of every single thing that happened from that patient, from their entrance at birth all the way through to the end of their life. And so every interaction you have with a patient, you need to really clearly document that. Because then the next person that sees you.
Dear Lisa, dear Lisa, could you please check your internet connection? I have checked here. Might be it's your site. Would you please check it?
I can quickly check. I think it's fine though. Just give me 1 second.
Is it fine
Uh,
there?
yeah, 100%. 100%. It may be a little bit of a lag.
Your voice is breaking.
Oh no. I wonder if it's my microphone. Let me check. My
It's breaking.
microphone.
I can hear you, but it's breaking because of internet connection as we face the issues now. Like
Yeah.
reconnecting, it's like that.
See,
Sometimes
my
I hear you and sometimes I can't. There is a challenge to
oh
hear you clearly. It's like this. It's all
yeah.
about internet issue.
Okay. So mine seems to be
I have
100%.
checked mine.
Yeah, and I can hear you very
Hmm.
clearly. Um,
You
and
can hear me.
oh yeah, very clear. Yeah. So I'm
Yeah,
hoping
might
that
be my side.
little bit like you're
I do have two
underwater.
internet connections.
Yeah.
So I have tried both of them now.
And you are loud and clear for me.
Okay, so let's move to another question. If you have you completed the previous one?
Yeah, yeah. That's so yeah, I was just talking very quickly, practice the structure of the exam. There you go.
Hmm. Okay, so next question is how to prepare for OET. We have done this one.
Mhm.
Common challenges and solution to pass OET. It's the same as you elaborated, like vocabulary and time management as well,
Yeah,
we can
absolutely.
say.
So the exam itself is a timed exam. It's in 4 sections, as you would imagine with any English or language exam. You've got your reading, writing, speaking, and listening sections. Um, like I said earlier, one of the most challenging areas is the writing. So having a good tutor that can check your levels and your skills and give you more and more challenging medically specific documents to practice on, like, for example, a
Hmm.
patient discharge summary or a patient plan of action. Um, and so having plenty of practice in plenty of time is one of the most important things that you can do. Um, so if you want, I can talk a little bit more about the structure of the OET, if that will help.
Yeah, you may, because
Okay.
it's our topic and we could elaborate as much as we could.
Yeah. So the OET, like I said earlier, it's usually over about 3 hours. So it's quite a long and
Okay.
intense exam process. The listening part um, is usually about 45 minutes, um, which has uses recordings from real healthcare contexts. So you might, for example, have to listen to a patient and a doctor having a conversation, and the task that they may ask you to do is to write notes on that consultation, and to include things like your symptoms, your patient history, any concerns, any treatments or medication they may have had. So that kind of tests the accuracy and ability to identify the key clinical information that you're listening to, which is really important. The second part of the listening is usually workplace, sort of short extracts lasting about 10 minutes. They usually give you 3 options on that section. So you'll hear short workplace conversations or handovers. So a handover would be one doctor finishing shift and another doctor starting shift. So that would be a handover, for example. Nurses do it. We all do it. Every healthcare professional does it at the end of a shift. We hand over to the next set of workers that are coming in. And so they kind of test your understanding, detail, and need you to explain the purpose of what is going on in that heard conversation. And then sort of the third part is presentations and interviews, which lasts about 20 minutes. It's like a multiple choice. So you'll hear slightly longer talks, interviews, other discussions on healthcare topics, and their focus is understanding or assessing your opinion, your attitude, and the meaning behind the words that you're hearing in a medical setting. So that would be your first part of the OET, listening around 45 minutes in total. I'm not sure if I've lost Sidra, but because sorry, I was just saying I think I lost you, Sidra, but because it continued to
I am
record.
really sorry, dear. I am challenging internet issues today. I really
Don't,
regret
it's
for that.
fine. It's absolutely fine. So what I did was I continued explaining even when you were off screen. So I'm hoping that it would have recorded what I had to say, and then you might be able to upload it and listen to it later.
Sorry, I did not get your point.
I was saying when I lost your connection, I was still on screen. And so I continued to talk through the first part of the OET exam, and hopefully that will have recorded,
Yeah,
and so you
it's
can
okay.
share that.
Yeah, it would be recorded. Our audience would be watching you definitely if I was not there, no? So I
Super.
think it would be recorded. It's okay.
Yeah,
We just
super.
have to go ahead.
Yeah, and I'll just carry on talking if I lose you, Sidra, don't worry. So
Just carry on. Be
yeah,
confident. Let
so
it,
that
whatever happens.
yeah, we'll just work with it. This is what happens in healthcare. We just have to figure it out. So it's absolutely fine.
Yeah,
So
yeah.
the second part
So
of the
let's,
sorry, go on.
okay. Second part.
Second part of the OET is the reading test. And so that is around 60 minutes of your 3 hours. So for 1 hour, there are again 3 parts to that: part A, B, and C. Part A is what's called expedited reading, and it's matching words with definitions. So it'll say cardiothoracic. What does this mean? And you'll have a few options to choose from. So it's kind of linking words with their meanings and definitions. So that's about 15 minutes. They could be like fact sheets, healthcare fact sheets, so signs and symptoms of the flu, or vaccine uptake records, or whatever it may be. Anything, it could be anything, but it kind of tests your speed at scanning text rather than sitting and reading every single word. So it's kind of a speed read section, and selective, pulling out keywords. So that's expedited reading section. Then you have workplace texts. So that again, usually multiple choice type questions. It'll be like memos or shared information from one department to another, and it'll ask you multiple choice questions. So who's who is this memo from? What is it about? What are the key takeaways? So that kind of assesses your reading skills with medical literature in terms of what would actually be found in the workplace, in the NHS. So not reading necessarily medical journals or large documents, it's workplace specific reading. And then the final sort of part of part two is that slightly longer text, and this is where you would see longer professional or sort of smaller academic type articles. And again, you'll have multiple choice questions that will ask you to identify key themes in the text. What is the literature discussing? What are the stats that you can get from that literature? Again, multiple choice questions. So you spend a little bit longer because that is a professional or a clinical article, medical journal type reading task at the end. So that's usually a bit longer. So that's reading. There's quite a lot. And I don't want to keep you too long, but I'll just quickly go on to 3 and 4.
No, it's okay. It's informative.
Yeah,
Our
and
main
people,
motive is to discuss about deeply that what's the process and what are the challenges, how to overcome. So these are the
yeah,
parts, essential parts, as you are elaborating.
okay. So the third part then would be the writing task, which again, as I've said lots and lots of times, this is the part that most people really do struggle with. Again, it's about
Hmm.
45 minutes of the entire 3 hours that you have to spend on your writing tasks. And
Hmm.
so often they will ask you to write a letter about a patient based on case notes. So you'll get, this is your patient's file. This is Mrs. Sidra from London, and she was admitted to A&E with abdominal pain. She's 55 years old. She's weighs this. So it'll have lots of clinical details and what
May
they
it not
want.
happen.
Yeah. And what they're kind of testing in that is that the letter that you would then write to a consultant or their GP to say they've seen
Okay.
us. This is the information that we've gathered. These are the tests that we've carried out. This is our recommendation, and it's testing clear written skills. So this is a part where you need to really be very careful with things like spelling, clarity of your sentence structure. Can't get
Hmm.
words mixed up because in medicine, getting left and right mixed up if you're in surgery is the absolute worst thing you could possibly do. You don't want to go and have your left kidney removed when it was your right one that was falling apart. So they really do test, and it's very, very important that you get the written
Yeah.
practice in. So the more you can practice writing letters, handovers, um, anything medical that you would do as a professional now in the country that you're currently in, learn how to do that in
Hmm.
English and learn that high standard of writing in English and practice it every
And
day if
it's
you
all
need
about
to.
formal
Yeah,
writing,
it's
medical
form.
plus formal writing.
It is exactly, yeah. And so
Hmm.
because the patient outcomes, the patient's life and health is going to be impacted by the words you use on a medical letter.
Hmm.
So you need to be perfect with that. You really do. As even if you're English, this is an area where you need to be perfect. Long gone are the days where doctors' handwriting is illegible because that used to be the joke that if you're a doctor, your spelling and your handwriting was terrible. That's not the case anymore. So even as an English health professional, your writing skills need to be clear and legible and correct because the patient's life depends on it. So that is a really important skill. So yeah. So they are. So practice, practice, practice is what I would say with your clinical writing skills. Copy your anything you've done that day, write it out in English. Shred it and throw it away. Don't obviously have patient information on it that's confidential, but do that every day, every single day that you can, for as long as you can before you take that exam, because it's so critical. So critical.
Obviously.
And then
Yeah, I couldn't
equally,
agree more.
yeah, when it comes to part 4 of the OET, which is the speaking part, again, it's so critical because what you say to a patient and the way you say something to a patient can make a huge
Hmm.
difference to their journey. So, if you sound dismissive or you sound unsure, less confident than you should, if you sound rude and too direct, if you say to somebody, for example, well, you've got bowel cancer, so we're going to cut that out of your body, you would be horrified if a doctor said something like that to you. It might be literally true,
Obviously.
but there are ways of saying things. There are ways of breaking bad news. There are ways of getting a point across that it's urgent without terrifying a person. So your speaking it's
Hmm.
not just the words, it's how you use those words. And that's a huge part of what I teach
Hmm.
personally. It's not what you say, it's
Hmm.
how you say it. So they
How
test that.
you treat, it's all about
Yeah,
your behavior, that how you respond, how you react, how you answer.
it is. And I think there are doctors that are native English doctors that are terrible at this. They're terrible at
Hmm.
getting to the point, getting the information across, because people don't
Hmm.
enjoy breaking bad news to people. People hate to disappoint
Hmm.
people or let them down. It's it's a skill to learn, and one of the most, in my opinion, one of the most important skills as a health professional is how you speak to your colleagues and how you speak to your patients and their family
Yeah,
members.
it is. You mean to say that it's not about only your English proficiency or your English speaking or writing, listening skills. It's all about professionalism, empathy as well. How you treat your patients. Patients.
Yeah, that empathy that you said, that is the key word. That
Empathy.
empathy is so important because it's health is such a difficult subject because, like I said before, no one wants bad news, but equally we have the internet. We have the internet and we have Dr. Google, because the people will come in and be like, I've got this wrong with me. Google said I've got a brain tumor. And for a healthcare professional to sort of go, don't be stupid, that's Google, can be a little bit dismissive of somebody's symptoms. So rather than being like, well, you're being stupid, don't look at Google, what you would say is, right, tell me
Hmm.
about what you are actually experiencing. Tell me why you think that is. And let's see if we can figure out together what's going on.
Hmm.
So
Okay,
there's,
dear Lisa, let's talk about NHS recruitment process for international healthcare professionals.
yeah, no problem. So the OET grade that you're looking at to be able to work in the NHS would be grade B, which is like a grade 7 equivalent on the IELTS. So a score of
Would you
350 and
please
above.
rejoin, dear Lisa?
Sorry, have you lost me?
Would you rejoin?
Would I read? Sorry. Am I
Yeah, would
out?
you please rejoin? Might be it solves.
One second. One second. I'm back.
That's great. Thank
Can
you,
you hear me
dear.
okay? Can
Thanks
you
for
hear
your
me?
patience.
It's fine, don't worry. So yeah, so
I appreciate it.
the OET grade that you need to be able to work in the
Hmm.
NHS in the UK is 350
Hmm.
and above. So 350 is your minimum. And it goes up to 500. So it's the equivalent to a 7.5 on the IELTS. It's that kind of level scoring. So it would be a grade B in English old way of assessing things. So it's a grade B or a grade A to be able to work there. You need a registration in your profession.
Hmm.
So it's either, if you're a nurse, it would be the NMC, Nursing and Midwifery Council. If you're a doctor, it's the what's the word? The General Medical Council, GMC, and then there's the HC, healthcare, which is the Allied Healthcare Professionals. So you need to be registered with one of those governing bodies, like that. You have to be registered to be able to practice in the UK.
Hmm.
And then obviously the OET, and you would do an application. There is a website that most NHS jobs are advertised on, a very specific website. So
Hmm.
it's actually called NHS Jobs. So you want to go on there. You want to have a good CV, which has your qualifications, your registration number would be on there, or resume. I don't know if you call it a CV. In America, that would be your resume. With obviously your experience and your qualifications on, and your OET grade, or at least your OET expected grade, which you can get if you have a tutor. If you've got a medical English tutor like me, we would give you lots of mock tests, and so you'd have an expected grade. So that can go on your resume or your CV, to apply in advance. Um, and that's it. That's all you need. Yeah. So your doctor, nurse, healthcare qualification, registration with the appropriate UK governing bodies, and an OET score or expected score of 350 and above. You'd need
Fantastic. Oh,
sponsorship as well for certain sort of visa requirements, but best to check on the current visa requirements because they do tweak and change a little bit.
hmm. Hmm. Okay. Let's talk about particular roles that require OET. How could healthcare professionals be prepared for it? Are there any particular roles?
Yeah. So the most obvious are your doctor of any speciality, nurses, pharmacist or pharmacology, so the people that dispense the medication, or I call them the oracles of all knowledge. A pharmacist is the best friend you can have if you work in the hospital. Find out who your ward pharmacist is and get to know them because they know every safety thing you need. They're wonderful, wonderful fountains of knowledge, a pharmacist. So they would be another specialty that would need the OET. And then your allied healthcare things. So physiotherapist, occupational therapist, phlebotomy. So lots of individual, what we call allied health professions. So it's doctors, nurses, and all the other things, all the other jobs at a hospital that you might want. Healthcare assistant, for example, nursing assistant. So lots of jobs.
That's great. Dear Lisa, it's been really a great discussion with you despite of having internet issues. I apology for that. I really regret as I expected that it would be a very smooth and really enjoyable way to discuss about, but unfortunately I'm facing the internet issue. So I really apologize for any inconveniences, but you have tried your level best as per your expertise. You elaborated it very well, and I really appreciate your patience as well.
It's been my pleasure. If there are any questions that anybody watching has, feel free to sort of drop me a message either on LinkedIn or they can go on to TIO. Like I said, I'm not the only medical specialist on there. We have lots. And so there's even some sort of medical test prep tips that you can get on TIO, which are free to access. I am working on building an entire sort of module course, which will
Hmm.
be much more detailed, but I've not done that yet because who has the time? So, yeah, it's been a pleasure. Any questions, please just reach out to me. I'll be happy to answer anything that anybody has. But it's
Yeah,
been lovely
surely they are
talking.
most welcome. They are
Thank
most welcome. If I talk about our audience, so they would be watching us and they would be feeling the same might be relevant to internet issue. So most probably it would be inconveniences to listen or understand clearly. So it's okay if you do have any questions, you may ask us relevant to OET or NHS privately, or if you want to reach TEO Academy or Lisa directly. So she is available on Facebook, Instagram, or LinkedIn. You are most
yeah.
welcome as she is an expert in this field. She would guide you better. And if you want to take classes by her, especially relevant to OET for healthcare, career, or any guidance, then she is there to assist you. And I would recommend her 100% as, mashallah, she is qualified, even I
Thank
saw.
you. Thank you, Sidra. That's very lovely. What I will also do, because we had some technical issues, is I will just send you some key point notes. And then if you are posting this onto your YouTube channel, which I believe you have, MSK Linguistics, um, I will. You can add that to the
Yeah.
comments, and people can see what we've covered today. So that we can do that as well. So that's fine. But yeah, happy to speak to anybody and been lovely to meet you. Thank you so much for having me.
So kind of you, likewise, dear. And I really appreciate your time. Thanks for giving me your time. It's almost an hour. It means a
Oh,
lot.
it's my pleasure. It's my pleasure. Thank you.
Thanks again for sharing your knowledge with us.
It's not a problem.
Really nice to meet you, and
It was
hope you
really,
to have you again with any other relevant topic relevant to medical field, especially as I imagine that you are an expert and you could do it very well. If I need any professional as your field, so I would definitely invite you or would like to collaborate with you for this purpose.
that would be absolutely fine. I could talk about this subject for days, Sidra. So if you need content, you just call me because I can talk to you all day long about medicine and healthcare and the OET and everything else in between. So yeah, happy to do it.
Okay, dear Lisa. Take care.
Thank you. You take
Wish you
care.
all the best.
Thank you. Bye, everybody.
Bye.
Bye.
Bye.